Hi, welcome to our telehealth medicine information video. I'm Garvin and this video is on a new injection called Ajovy. So Ajovy is indicated for prophylaxis of migraine in adults who have had at least 4 migraine days per month. So how do you use Ajovy? You use Ajovy injection exactly as was prescribed in the first instance. You follow all directions on your prescription label and read all medicine guidelines or instruction sheets. Ajovy is injected under the skin. A healthcare provider may teach you how to properly use the medication by yourself. Ajovy is usually given as 1 injection once a month, or as 3 injections in separate syringes once every 3 months. So you read and carefully follow any instructions for use provided with your medicine, and do not use Ajovy if you don't understand all the instructions for proper use. Ask your doctor or pharmacist if you have any questions. Prepare your injection only when you are ready to give it. Do not use the medicine if it looks cloudy, has changed colour, or has particles in it. Call your pharmacist for new medicine in this instance. Store Ajovy in the original carton in a refrigerator, protected from light. Do not freeze or shake the medicine. Take the medicine out of the refrigerator and let it reach room temperature for 30 minutes before injecting your dose. Do not warm the medicine with hot water, sunlight, or a microwave. You may store Ajovy for up to 24 hours at room temperature. Throw the medicine away if it has been at room temperature for more than 24 hours. Each single-use pre-filled syringe is for 1 use only. Throw it away after 1 use, even if there is still medicine left inside. And by throwing it away, I mean bring it back to your pharmacy for proper disposal. You use a needle and syringe only once, and then place them in the puncture-proof sharps container and return to the pharmacy. Follow your local laws on how to dispose of this container. You keep it out of reach of children and pets. Ajovy dosing information. So for usual adult dose for migraine prophylaxis is 225 milligrams subcutaneously once a month. Alternatively, 675 milligrams subcutaneously may be administered once every 3 months. And its use is for the preventative treatment of migraine. Some of the side effects, and side effects requiring immediate medical attention. So along with its needed effects, Ajovy, or the active ingredient is fremanezumab, may cause some unwanted effects, although not all these effects may occur. If they do occur, they may need medical attention. So check with your doctor immediately if any of the following side effects occur while you're using Ajovy. So they would be fast heartbeat, fever, hives, itching, skin rash, hoarseness, irritation, joint pain, stiffness or swelling, redness of the skin, swelling of the eyelids, face and lips, and tightness in the chest, trouble breathing or swallowing. Some side effects of Ajovy may occur that usually do not need medical attention. These side effects may go away during treatment as your body adjusts to this new medicine. So check with your healthcare provider if any of the following side effects continue or are becoming bothersome. So they would be bleeding, blistering, burning, coldness, discoloration of the skin, feeling of pressure, hives or infection, inflammation, lumps, numbness, pain, and swelling or tenderness, ulceration or warmth at the injection site. So for Ajovy for pregnancy, the benefit should outweigh the risk in the first instance. So the risk summary, there is no data on the developmental risks associated with this drug in human pregnancy. Published data suggests that women with migraine headaches may be at an increased risk of preeclampsia during pregnancy. The estimated rate of birth defects and miscarriage in women with migraine are similar to rates reported in women without migraine. There are no control data in human pregnancy. So if you're pregnant, get advice from your doctor or consultant before using Ajovy and let them know you're pregnant. So Ajovy during breastfeeding, so the benefit again should outweigh any risk to the baby, and there is no data on the effect of this drug on a breastfed infant or its effect on milk production. The developmental and health benefit of breastfeeding should be considered along with the mother's clinical need for this drug and any potential adverse effect to the breastfed infant from the drug or from underlying maternal condition. So the dosage, the usual adult dosage for migraine prophylaxis is 225 milligrams subcutaneously once a month, or 675 milligram may be administered once every 3 months. To administer the 675 milligram subcutaneously, 3 consecutive injections of 225 milligram are given. If switching dosage options, administer the first dose on the new regime on the next scheduled date of administration. So some precautions: serious hypersensitivity to the active substance or any product excipients have occurred, and the safety and efficacy of this medicine has not been established in patients under 18 years of age. So other comments about administration: for subcutaneous administration use only, and administer 1 225 subcutaneous injection once a month, or 3 separate 225 at 3 different sites once every 3 months. You administer subcutaneously into the abdomen, thigh, or upper arm. For multiple injections, the same body location may be used, but injection sites must be rotated. Do not inject into areas that are tender, bruised, red, or indurated. Switching dose option. So administer first dose of the new regime on the next scheduled dose of administration. For a missed dose, if a dose is missed, administer as soon as possible. Thereafter, next injection can be scheduled from the date of the last dose. For storage, proper storage, so when it is not in use, it should be refrigerated from 2 to 8 degrees Celsius and protected from light. And when in use, once removed from the fridge, it may be kept at room temperature below 25 degrees for 24 hours. Do not shake, do not freeze, or expose to extreme heat or sunlight. So that brings this video to an end. If you have any questions, you can leave them in a comment below or contact us through our website, mytelehealth.info, or call to Lynch's Pharmacy, Douglas, Cork, or ring 436-6923 to find out more. Thank you for watching. Stay healthy and stay informed.